Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. In today's topic, are there new medicines for osteoporosis? What is osteoporosis?
Bone thinning.
Who is the most at risk for getting osteoporosis?
It's thin, white, sedentary, postmenopausal female smokers are at highest risk.
Are men at risk for osteoporosis?
Well, yes, the big difference between men and women is that men go through andropause, which is the equivalent of menopause, much later. 70 to 80 would be a usual time for men to stop making testosterone. So yeah, then they would be at risk for osteoporosis. And of course, if they have treatment for prostate cancer with the medications that neutralize testosterone, those men are also at risk for osteoporosis.
How do bones stay strong?
Now, bones are actually living. We sometimes think of them like a post or a piece of wood, but they're more like a tree. They have a bone resorption process, and that's predominantly by osteoclasts. In other words, they remove old bone, and they have a remodeling or a bone replacement process, which gives new bone, and that's done by the osteoblasts. So bone stays strong because you're continually laying down new bone.
What causes bones to thin?
Well, menopause is the biggest problem, either for women or for men. Being without hormones is a problem. Again, smoking is bad. Diet can be bad. So, but basically, when the osteoblasts quit working, that is the bone builders quit working, that's when bone thins.
How do medications managing osteoporosis work?
Well, most of the uh, medications, the what we call the bisphosphonate, the first group of bone stabilizers, work by decreasing the osteoclast activity. In other words, they decrease bone resorption so that you have more accumulation of old bone. Although it is thicker bone, it's older bone.
What's new in the treatment of osteoporosis?
Well, there's something called biologics, and I spent a lot of time trying to figure out what exactly is meant by that. But a biologic is different from a drug because it's made from living cells. There are two examples. There's Prolia, which is medication given by shot twice a year. And then there's Evenity, which is the one you see on the TV all the time. And that is also it does work partly by uh, decreasing bone um, resorption, but it also works by building new bone. So, but there are problems with both of these things: musculoskeletal pain, back pain, chest pain, and low levels of calcium. These are all problems. Evenity, the one that builds bone, there's a risk of stroke, heart attack, vascular disease, and you can only take it for a year. It's 2 shots once a month for 12 months. That's the end of it.
What are the two new biologics used to treat osteoporosis?
Well, the like I said, Prolia is one, and Evenity is the other, and they are both given by injection. But you can give Prolia forever, and it's twice a year shots.
How are these medications given?
Well, like I said, the Evenity is 2 shots once a month for 12 months, and the Prolia is a shot twice a year.
Who should take these medications?
Well, postmenopausal women, especially women who are sedentary, who smoke, who are thin, and Caucasian, those But the thing about it is, they are never the first line treatment. So they are used for women who have failed other treatments. The most common other treatment, or the most common beginning treatment, would be something we call bisphosphonates.
Who should not take Aventi?
Well, women who have low calcium, or women who've had recent heart attacks or strokes.
Were not hormones unaccused to treat osteoporosis?
Hormones were once used. As a matter of fact, estrogen and progesterone were commonly used for a long time. Then we had the WHI study from 2002, which said that there was an increased risk of endometrial cancer, breast cancer, heart attacks, strokes, and pulmonary emboli. There is something that is it's called roloxifene. Well, that's the generic name. The brand name is Evista. It mimics estrogen, but it does not increase the risk for breast cancer. It does increase the risk for hot flashes.
What about bioidentical hormone replacement therapy?
Well, I think it's a good thing. It's just not the first line of treatment. You would get it if you can't use one of the bisphosphonates, like Fosamax, Actonel, one of those. It's not first line treatment.
Okay. Best place to go is worlddocallen.com and pick up Pregnancy Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.